everybody. How
Hello.
are you guys? I have Miss Tulsi Desai here. So first of all, thank you everybody for joining us today at Tea Time with Quest Care at noon. First of all, go get your tea and get ready for a wonderful session with Tea Time on Quest Care. I have today with us wonderful expert physical therapist, Miss Tulsi Desai here.
Hi,
She
everyone.
is a friend, she's a colleague, and she is an expert in physical therapy. I am going to tell you a little bit more about her, but first of all, thank you so much, Tulsi, for coming down here today and giving us a talk to our Tea Time viewers. I am superbly honored and blessed that you are here today.
Thank you so much for having me.
It's our pleasure. She is a great expert in the practice that she does for physical therapy, but besides that, she's a wonderful human being. Let me tell you guys a little bit about Tulsi. Before I start, everybody logging in today, we are here, Tea Time with Quest Care, talking to Tulsi Desai. So Tulsi graduated from California in 2008. She has over 12 years of experience as a physical therapist. She has treated a variety of orthopedic conditions as well as women health and pelvic floor problems. She has worked with leading orthopedic surgeons. She has worked with specialist doctors at NYU. She has worked with the Hospital for Special Surgery, and she has worked for private doctors in New York City. She has done amazing work, and she's very experienced and talented in what she does. What I love about Tulsi, that she's very passionate about her work. She's very passionate about women's health, and she focuses on creating individualized treatment plans that actually include the whole body rehabilitation, which then helps her in optimizing the patient's overall function. Her practice, she's the owner and the practitioner at Active Body, Active Life Physical Therapy and Wellness. I am going to put her website on our comment sections for anybody who is gonna want to get her information. And she offers telehealth visits as well as in-person consultations too. So thank you again, Tulsi, for coming today. Tulsi and I are gonna actually today talk about obesity and pelvic health problems. We all have been talking about obesity in the past few Tea Time videos, but today I actually wanted to bring awareness to pelvic floor disorders and pelvic health. A lot of people have correlated obesity with heart attacks, stroke, diabetes, arthritis, kidney disease, but I think there is little less awareness on how obesity can lead to pelvic floor disorders. There are disorders of urinary incontinence, pelvic organ prolapse, overactive bladder. And today my goal is to give my viewers a little awareness on how obesity can lead to pelvic health disorders. So Tulsi, tell us about what is pelvic health and what are some pelvic floor disorders.
So, it's easier to show what's pelvic health, and I'll start with what is pelvic
I love
floor.
that she has a nice model here for us. That's awesome.
So basically, this is pelvis, and the red musculature you see, it's all pelvic floor. We call it pelvic floor, but these are pelvic floor muscles, and there are multiple muscles, but we just for convenience sake, we'll call them pelvic floor muscles, and it's easier to understand. And then there are superficial and deeper muscles, and based on which layer is affected, women can present with different symptoms. And when we treat pelvic floor, we do address these muscles. They're also very deep muscles, so it's not as easy as just bending your elbow or massaging your biceps.
Yeah.
It's much deeper and it's much complicated. There are so many organs inside. So there is uterus, bladder, rectum, everything. All those organs sit inside your pelvic cavity, and they are supported by these pelvic floor muscles. And when there is a neurological dysfunction or neuromuscular, which basically means the nervous system and muscles don't have coordination, and that coordination can be disrupted by multiple reasons: trauma, pregnancy, delivery, and obesity is one of the risk factors. And we'll go into more details later, but that's what pelvic floor is, and it affects every single function. It affects your bladder control, bowel control, sexual function, and pregnancy, postpartum, and menopause, and just overall health in general. And since it's a central part of your body, it connects your upper body with your lower body, it can affect legs as well as torso. So based on what a person is complaining, we look at above and below, and that's where I love the individualized program and not just every knee replacement patient gets on a bike. Like, that's not how.
Absolutely,
We have to look at what's causing it, what are the other risk factors, and then decide what would be the best strategy to treat
for that particular person. Take it case by case, right? Anybody who's joining us today, we are doing tea time with Tulsi Desai, a physical therapist, master's in physical therapist, owner of Active Body and Active Life. We are here talking about pelvic health and obesity. Before I move on with our questions with Tulsi, I am just going to tell you this is not for any personal medical advice. Our show is for entertainment and your information purposes only. I highly recommend that you view it, share it with your friends, your colleague, your family members. Share it, like it, rate us, give us questions. If you put questions on here, we will try to address it today. If not, in the next session, or we'll leave the answers on the comment section in the later in the day. And let's see. So you wonderfully told us about pelvic floor. What are some disorders that you see with the obesity?
So most common problems that are prevalent are incontinence. Especially
yes.
Urine leakage. Especially women above 65, 50% of them are leaking. And there are multiple different types of leakage. So stress incontinence is one where you just cough, sneeze, laugh, pick up something heavy or bend down and you leak few drops or more. And urge incontinence is where you get the urge and you have to go right away. You can't wait for 10 minutes or half hour.
You can't
then,
make to the bathroom.
You may start leaking. And then mixed incontinence is combination of urge and stress incontinence. So they would have both. Any pressure from above will cause leakage, as well as the urge will cause leakage, and they won't be able to control it. And
a lot of people don't realize that it's such a traumatizing and disabling disorder. Because can you take road trips because of this? No.
Yeah.
Can you do a visit to a family friend? No, because if you're leaking urine,
it's embarrassing.
It's embarrassing.
Yeah.
Can you? I'm sorry, but if you're leaking urine when you laugh, I don't think so. I can go and see a stand-up comedy
or enjoy anything.
Yeah. So it's important to shed light on this, which is why I wanted to see that how obesity can lead to these disorders. And a lot of people might not realize that when obesity weakens the musculature at the pelvic health, which further does not let the bladder contract in time, further pushes bladder down, further gets you to prolapse of your pelvic organs. And then furthermore, obesity does other diseases. So the diabetes, people have polyuria from it. So now you have polyuria and you have a prolapse and you have incontinence.
That can also lead to bladder irritation that can lead to increased frequency and more leakage. So diabetes has a lot of other consequences.
Obesity itself, not only that it comes in a package disease of diabetes and blood pressure and cholesterol and kidney issues, but then you have the pelvic floor disorders.
And obesity is a risk factor as well as a cause for cancer. And that can lead to a lot of different types of cancer. So that's another factor that can be all combined with pelvic floor issues and leading to other diseases. Yeah.
Right, absolutely. And I purposely wanted to talk about pelvic floor disorder and obesity. We are in our pandemic. Everybody has heard about COVID pounds that we are putting on because of this pandemic, sadly. And I think I've had cases, my colleagues have had cases where incontinence have become quite a nuisance. And with the obesity comes the back pain, the disc herniations, and they further exaggerate your pelvic health disorders. So that's the reason we were going to do a quick talk on this today.
And you bring up a really good point in terms of obesity leading to back pain or correlation between, because the pelvic floor is inside the pelvis, but there are abdominal muscles in the front and they actually work hand in hand. So there is a neuromuscular coordination between pelvic floor and abdominals, and when somebody has central obesity, their abdominal muscles are actually affected by that additional weight, and that can lead to poor spinal stabilization as well as poor control of the pelvic floor. And that can a lot of patients, when I get, especially female, they have pelvic floor issues and low back pain, and they just think these are two separate problems. They keep going to regular physical therapists for low back pain, and the pelvic floor is never addressed. And no wonder every 6 months, every few weeks, their back gives out. They need to keep going to the chiropractor because a major component of their health is not being addressed. And that's where we need to look at a person as a whole person and not just back pain or knee pain, because biomechanical chain, something going on in one end of your body can still affect the other end, and we need to look at the whole chain. So we can't ignore abdominal and back region when we are addressing pelvis or vice versa.
I see. Then tell us a little bit about the organ prolapse. What to look for, how would patients feel when they have a prolapse but they don't know that there is a prolapse?
Right. So basically any organ can prolapse through vagina, and so there is bladder prolapse that can happen. There is rectum that could be prolapsing from the posterior wall, and the uterus can prolapse as well. Now, a lot of times when organs are prolapsing, people will initially start feeling heaviness, or it could be combined with urinary leakage or hesitancy fully emptying the bladder. So if somebody is having bladder prolapse, their bladder is sitting in a different alignment and they're not able to fully empty the bladder because it changes the pressure in gradient between the bladder and the outside of the body.
Absolutely.
So either hesitancy of fully emptying the bladder, or hesitancy of starting the urine stream, or just heaviness inside the pelvic area, or they might actually see something prolapsing out they might feel something pushing into the birth canal when they are coughing, sneezing, or when they are constipated. They may feel like they try to push, and something is coming out of the vagina. So
that sensation that something is coming out.
Or I've had patients where they can actually see it, touch it, and that's just a little more advanced level of prolapse, because there are different levels of prolapse. And I generally have the examining doctor confirm it, but I can also at least say, I think you have prolapse, and let's make sure your doctor confirms it. So we just want to make sure we are not misdiagnosing them. But the sooner we address the prolapse, so if somebody is having these initial symptoms, it's easier to treat it. Plus we are limiting the connective tissue damage. So the fascia and ligaments and all that, we can't change that. We can strengthen the muscles, but we can't change other ligaments holding your organ in one place. And once those structures are stretched out or damaged in some way, that's when, if it's extreme, they will need surgery, or then it ends up being a hysterectomy. So they'll remove the uterus out, but what happens, the weakness and the mechanism of prolapse is still there. They'll start having their intestines prolapsing into the birth canal, or they could have other organs prolapsing. So hysterectomy is not the final solution. Somebody may need it for various reasons, if they need the uterus removed because of cancer or fibroids or whatever, but rehab is needed after the surgery too.
Absolutely.
Because if somebody goes through muscle tear anywhere in their body, and they will go through rehab. If that didn't work, they will go through surgery, and then they will still go through rehab. So pelvic area is just another musculature and another area that needs to go through rehab. So ideally, after every hysterectomy, every pregnancy, women should go through rehab to make sure their nervous system, their muscles, bones, everything is back to normal functioning, and not wait for years until it becomes a prolapse, or until it becomes something that needs surgery or major interventions.
Try to get it in time before
and if we can control obesity and other health comorbidities, they're actually preventing all these problems beforehand and not have to deal with the consequences or damage control at the end.
Absolutely. Some symptoms, I had patients who would tell about pelvic floor, who suffering from pelvic floor disorders. They would come and tell me, I have a ball-like sensation sticking in my vaginal area. Some very common symptom I get from patients is painful urination, which could be sometimes a UTI, but a lot of time, even if it's treated and the urine analysis looks clean and the pain persists upon urination, that's definitely a pelvic floor disorder that's not diagnosed yet. Then I have had patients where patients feel chronic pelvic pain and lower back pain. Some other symptoms that I came across is painful sexual intercourse, where it's part of life, and having pain in that area can be quite traumatizing, and it traumatizes your home life. It traumatizes you as a human being. Intimacy is a bigger part of us as humans. We are social beings, and it's important. But pelvic floor disorder can come as painful sexual intercourse.
And that's actually, that itself is one of the conditions that I treat, and a lot of time younger women have that problem too, whether they have had kids or not. So I think 1 out of 4 women goes through sexual pain at some point in her life. For some, it is ongoing for years, and they just don't know how to find help. They're ashamed. No, they think they are the only one having pain, but it's actually very common. A lot of times there is misconception. they just think it's normal to have pain, and they just bear through it to make the relationship
Right, they
work.
think this is normal.
Right.
This is how
There
it
are
should
times some of my patients find me, on an average it takes 6 to 8 years for pelvic floor dysfunction, anybody having pelvic floor dysfunction, to find a therapist who can actually treat it, or even to figure out that there is help out there, because they change from doctor to doctor to doctor. And unfortunately, I've had patients where their OBGYNs told them that, oh, I feel sorry for your husband that you are in pain and you're not giving him sex. And it's just really sad. I'm not saying everybody's like that, but it's just misinformation out there. And there is pelvic floor therapy where we can release these muscles.
Oh, okay.
And so it's a muscular pain. It's actually a medical condition that can be treated so easily. So if somebody had car accident and they end up having neck muscle spasm, you don't tell them keep rotating your neck and it will get better. You tell them put heat pack, muscle relaxant, whatever. So this is just a spasm inside the pelvis. And if we can relax those muscles, and if we can tell the nervous system it's not dangerous anymore, we can take away the pain, and they can actually go back to normal sexual life without any pain. So that's just simplified explanation of why people have sexual pain. And so after having childbirth, there could be stitches that can lead to spasm. There could be actually traumatic experience that could lead to, any sexual trauma can lead to at any point in life. Fracture, pelvic fracture. So there are so many reasons why somebody would feel pain
upon intercourse.
And other issues just add to it, basically.
Got it. We have one viewer here. Hi Miss Uzma Irfan. Thank you for watching, and good afternoon. Lovely seeing you there. Thank you for joining us. For people who are just joining our tea time, I am here talking with Ms. Tulsi Desai. She's an expert physical therapist, and we are today talking about pelvic health and obesity and pelvic floor disorders. So Tulsi, you mentioned about pregnant females and postpartum, and I know diastasis recti is one of a very big problem. Can we shed light a little bit on the pelvic health and diastasis recti about?
So I think it's a medical term, so I'll simplify it.
Yes, please.
So
Yes,
diastasis recti is basically separation of the six-pack muscle. So when you see somebody really toned and you see six-pack, that it's a longitudinal, it's a straight muscle from your rib cage to your pelvis. So from top to bottom, and two strings, and that gets separated. Now, during pregnancy, in the last trimester, it gets separated for 100% of the women. And during postpartum, first year, it's when it actually recoils back and goes back to its alignment. And as long as the separation is less than 2 fingers, we are not worried. But if there is depth, so if it's more than 2 finger separation, it needs to be treated. And if there is depth, regardless of how many fingers, that's even more of a concern, because they can end up having hernia. And it just tells me that deeper layers of abdominals are not activating to stabilize this separation. And men can have it too. So men with really big bellies, they have a lot of adipose fat tissue, and they could end up having that separation, because it's same mechanism. Belly is expanding, and then the abdominal muscles are not strong enough to fight that, and they have to separate. And that's a protective mechanism, so there is no tearing that's happening. It's just stretching it out to protect damage to the nervous system or tissue. So first year postpartum is the best time to treat it, because we can make so many improvements and rehab that muscle. But at any stage in life, it's better to address it, because if we start strengthening the layers below, it will start stabilizing the top layer, and the separation would decrease actually. A lot of people also do crunches, and they just start exercising like crazy. But if your muscles are not engaging in the first place, if you have forgotten, or if your nervous system has forgotten how to use it, you're utilizing completely wrong set of muscles, and you're actually causing more back pain, more compression, and more pelvic floor dysfunction, because the abdominals maintain abdominal pressure, intra-abdominal pressure. And if that's not maintained well, the pressure inside the pelvis increases, and that pushes everything down and out. And so anus has a sphincter, and there is actually additional muscle that wraps around the anus, and it actually provides a lot of control. That's why fecal incontinence is not as common as urinary incontinence, because for women especially, the urethra is short. And it doesn't have as much stronger sphincter control, so it's easier for it to leak. But vagina has nothing closing it. So that's where organs can prolapse so easily, because we can't fight gravity. So if you have too much pressure from above, either because you have extra weight and extra fat tissue inside and around your belly, if your organs can have fatty disposition too, right?
Absolutely.
So
yeah.
there could be fatty liver and all.
Absolutely, yeah.
So additional weight in your central body will always load the pelvic floor more, and it will lead to
so pressure. So weight here, pressure on the pelvic floor,
right,
hence leading to
more problems.
More problems.
Right.
Is that what this will be explaining?
Right.
Can you explain us a little bit
so
more
I like
about
this chicken, but if you create more pressure in the tummy, I don't know if they can see it, what happens to the below? Everything falls out.
Can you guys see this? There's
that's gravity.
Oh,
yeah, that's an egg. But it's easier to understand rather than when I talk about things, I try to simplify, but I'm sure it's still very complicated to understand.
Subject,
so I think it's just easier to see.
And so what you're showing is a prolapse.
Increased pressure in the tummy will lead to increased pressure in the pelvis, and prolapse can happen. So, and it's common in women because we have additional structure that men don't have. So.
Wow,
yeah.
this is I like this prolapsing chicken over here.
Exactly. So
thank you. This actually simplifies for our viewers. I have some people here to say hi. Hi Rosalinda, thank you for joining and watching us. Hi Lynn, thank you for watching us. And whoever is just joining us, we are doing tea time at Quest Care with the expert Tulsi Desai. We're talking about pelvic floor disorders and obesity and how obesity links to pelvic floor disorders. We talked a little bit about incontinence. We talked a little bit about prolapse. We talked a little bit about overactive bladder. We spoke about some symptoms of it. And we talked gave our viewers a little bit of overview as what to expect in a pelvic floor disorder. So Tulsi, shall we shed a little bit of light on treatment? If somebody have pelvic floor disorder, how does the treatment usually look like?
So there is an external component of treatment because it's an orthopedic condition at the end. We are still treating muscles, bone, fascia, and alignment of the organs and how the muscles control that alignment. So it's still considered an orthopedic problem. There are neurological problems too, and if it's a neurological component, pelvic floor physical therapy may not be as beneficial because they do need a neurologist or neurosurgeon to intervene, or some medications to control the nerves. But most of my patients are orthopedic patients where we can change a lot of things in their body because there is an active control that patient has, and that's where the Kegels don't work for a lot of patients, and unfortunately they're just told by all the medical providers, nurses that go do Kegels, and that's done.
And we do Kegels for incontinences, usually for stress incontinence, and stress incontinence is leaking urine when you cough or sneeze.
Right.
And Kegel exercise is supposed to help build your muscles.
And it will help a lot of women. So I'm not saying it doesn't help because, of course, at the end, I'm also recommending Kegel to my patient, for pretty much every single patient. But it depends on when is the right time to do it. Because there are three types of pelvic floor dysfunction. So there is overactive pelvic floor. That means these muscles are constantly on and they are shortened and they actually don't know how to relax. And then they're fatiguing so much that the minute somebody coughs or sneezes, the muscle is already exhausted and it will relax fully, and then they'll have leakage. Now, this is not the patient where I want to teach them Kegel at a wrong time. I first want them to learn when to relax, when to squeeze, and when to stay neutral. And once they have that awareness and the length, then they can actually strengthen properly. If it's a short muscle, if my biceps is stuck here after my fracture, how much can I dumbbell and strengthen it? Versus if I can stretch it out first, I can improve the flexibility. Now I can fully use the dumbbell to strengthen the full length. So same thing with pelvic floor. Yeah, so same thing with pelvic floor. If it's not in its normal alignment, we first need to bring it to the normal length before we can strengthen it. And there are some patients who have like completely resting pelvic floor. It's actually below its normal alignment, and those are also more at risk for prolapse because they're not even keeping it where it should be. These are the patients where they will generally see benefit initially. They'll start doing Kegels and they'll feel better. They'll feel more control. They'll feel less urgency. But after some point, they will reach a stagnant level where they're not making any progress with Kegels. And because there are other things going on they don't even have awareness. So they're not even activating every single component of the muscle. They're only activating the stronger components. The weak ones are still just resting and they're not being the team player. So that's where I may have to actually do internal palpation. feel.
see
So I
the
can.
musculature,
So
yeah.
generally, when we do pelvic floor examination internally, it's same as gynecological examination, but we are not using any instrument. It's just one finger, and then it's a very private, closed room. It's just patient and I. If they want to bring a relative for safety, they or just to feel more comfortable, that's their choice. And then at every single step, we explain what's going to happen. So nothing happens unless I have already said, okay, I'm going to touch you here, and this is what you should be feeling. If you feel anything different, I need to know. So I'll ask them to squeeze my finger, and then I'll actually check every single component of this muscle, because this looks like one muscle, but there are actually major 3 muscles in there.
Yeah.
So I'm going to check every single component to see which component is not activating, and then help them activate that.
Yeah.
And then that becomes their home program. So it's just much more fine-tuning of what's not working rather than just a simple Kegel and just keep squeezing.
So there's therapy.
Right.
There is personalized therapy to help you with pelvic floor disorders. And when I say personalized, it means that it is case to case. Every person does not necessarily have the same kind of assembly line treatment.
Right. It's not
Tulsi
one
and
size fits all.
Right,
Yeah.
and Tulsi and I are a major believer of it, that not every treatment will work for everybody the same way. It has to be personalized to your comorbid issues, to your health conditions, to your musculature, to your body habitus. And that's why it's important to, if you have any symptoms, go see your primary care, go get it checked out. Pelvic floor disorders can be confused for other disorders: UTI, yeast infection, hemorrhoids, constipation. I just have a sciatica, and those symptoms, yes, they do happen, but even after getting them treated, you notice that the pain and the problem persist, and that is when I say that, okay, we have a bigger problem to deal with. So treatment for pelvic floor disorders is physical therapy. There are medications who can help your symptoms with incontinence, but things like prolapse and stuff, usually it's a surgical and a physical therapy rehab treatment that is required.
Yeah. And sometimes it's a combination. It's a teamwork. We need doctors. We need some medicine to calm down the nervous system or to relax the muscle. And that's where it has to be case by case, because what are the factors influencing this, and can we work as a team, physical therapy and doctors, and if anything else needs to be added, like mindfulness, yoga. If somebody's extremely anxious, and they might need a psychiatrist or a counseling to work on their emotional state, because a lot of people carry their trauma in their pelvic area, and their muscles are used to working certain way, and we have to undo that trauma. And not everybody needs therapy, but there are times I actually bring it up to patients. Look, I'm not trained to do mental health counseling, but I think it will help if we can do it side by side. So
I'm so happy you mentioned mental therapy, because obesity itself predisposes people to mental health disorders. We've spoken that in our
there's emotional eating that leads to
absolutely and then there is emotional eating that further makes your obesity worse, and then your pelvic floor problems become worse from that. So I'm so glad you mentioned that.
It is a multi-dimensional approach, and not just pelvic floor, not just obesity. We need to again look at the person as a whole, why they are struggling with obesity, when somebody else, it's so easy for them to manage. And then once we get to the root cause of the problem, the compliance is so much better, because we are now addressing what matters to that patient rather than what we think we should be doing as clinicians.
Well, these are beautiful pointers. I want to say thank you to all my wonderful viewers here. Cheryl is here. Hi, Cheryl. Thank you for joining and watching us. We've been talking about pelvic floor disorder, pelvic health, and how it links with obesity. Please comment on this. Please ask questions if you have. Share this with your family and friends and colleagues, co-workers, or any loved one who's suffering from this, because I'm sure you will get some pointers, some information from it to help you or the loved one. And if you recognize that this is something you need help with, please contact your primary care. I work at Quest Care Coppell. Tulsi has her own practice, Active Body, Active Life. I will put her website in our comment section. And Quest Care has 11 locations in DFW. If you need a primary care, please contact 214-712-2054 and find a location that's nearest to your residence, and we would be happy, and I'm sure providers will be happy to listen from you and help you and guide you in the right path for your symptoms, and to help you lead a better and healthy life. I want to say thank you to everybody who joined joined us. Thank you, Tulsi, for
Thank you so
joining
much for
us
having
today.
me.
We are going to do a quick raffle for all the wonderful people watching us. Adele, hi. Thank you for joining us. Hi, Sunshine. Thank you for watching us. We're going to do a quick raffle. So, Tulsi, do the honors and choose our winner today. Here we go. All right.
SA.
So, SA. So our initials are SA. I have your wonderful prize right here. Ta-da! It's right here. My office will be contacting you to come and collect your, I'm going to put it down there, sorry. To come and collect your prize here. I am going to say thank you to everybody who joined us today in our Tea Time with Quest Care. Again, this was a information to for your information and entertainment. No personal medical advice given by me or Tulsi over here. And please comment us, like us, share us, watch us on TikTok, watch us on Instagram and Facebook, and stay safe. COVID pandemic is still on, so stay safe. See you guys soon. Bye bye.